A nation's greatest asset is the human capital, but what happens when the human capital is not put to good use? Hello and welcome to another episode of the Women Series where we capture developments and stories that impact women. I am Ayomide Oguntoye. Today's conversation we're tilting towards the mental health, which plays a critical role in the development of a nation. And we're looking at how mental health in general can play a critical role in the development of a nation. And I have with me as my guest the Provost of the College of Medicine, University of Ibadan, Professor Olayinka Omigbodu. Hello, ma'am. Thank you for joining us on today's conversation. It's great speaking with you. It's quite an interesting conversation we had today, especially relating to mental health and how it plays an important role in the productivity and the optimization of an individual and a nation in general. Just to pick up on from one of some of the things you had highlighted today, how would you assess or how critical is the mental, they said we shouldn't say mental health now, maybe mental well-being or mental wellness or mental wealth as you referred to it. How critical is mental wealth to the stability and development of a nation?
Okay, no, there's nothing wrong with saying mental health.
Okay.
Mental health feeds into mental wealth.
Yeah.
Mental health is a state of well-being where the person is able to self-actualize. They're able to have meaningful relationships with others. They're able to adapt to stress. They're able to function optimally. You know, they're able to view things in a positive way, overcome challenges, overcome adversity, overcome change, and evolve well. So mental health is actually a very, very positive concept, and it emerges from health. You know, if you look at the definition of health, health is a state of complete physical, mental, and social well-being, not merely the absence of disease or infirmity. So mental health, when you look at it, it's something that's positive. It's not just the absence of mental illness or disorder, but it's a state of well-being where the mental health of the person is elevated by circumstances, the environment, and social issues, family factors, so they can function optimally.
Right.
Yes.
Yeah. I mean, I took that out from your conversation. I'm going to pick you on the part where you talked about immigrants as well. But
Yes.
before then, what our mental health law in Nigeria was recently revised and amended in 2021.
Yes.
But there are still other issues that are coming out. It seems to be that at this point where we are now, a lot of people are now self-aware, and there's so much awareness around mental health, and people are now beginning to be conscious of their mental health. And you see, sometimes I feel like it's even loosely used. But speaking to policies and governance, would you say that there are certain things we should also see or the government needs to do such that mental wealth is also very important, or they put a critical, what's it called now? A critical importance on mental wealth such that we see it in the overall development of everybody in the nation.
Okay, the context in which I used mental wealth
Yeah.
was I was proposing, based on some research and some viewpoints, that to be able to assess a nation's wealth, to be able to assess the progress, the development of a nation, how well the nation is doing, that rather than using gross domestic product,
Yeah.
which just shows it's like a balance sheet. So
Yeah.
we sell a lot of crude oil out, and we have money that comes in.
Yeah.
And then because we have a lot of crude oil, we now say, oh, we are wealthy. No, that does not measure the wealth of the nation. I was saying that, based on the research and the propositions that have been put forward, is that you should measure the wealth of a nation based on the Human Development Index, based on human capital, based on brain capital. That is the ability of the populace to be able to conceive, to enjoy mental health, optimal psychological functioning, the ability of the populace, to have, work well, to go to work, to be free of mental illness, to have an enhanced and beautiful life, that in itself is what should determine the wealth of a nation, and not how much crude oil you are selling or how much you are able to sell from ammunition and things like that. And I mentioned that there's now put in place some, like the United Nations put in place a way to measure the wealth of a nation. And there are three aspects to it. You measure their natural resources, you measure their human capital, and you also measure what they have produced in terms of manufactured capital. And you look at many nations, great nations, who recognize mental health, their biggest resource or their biggest measure is their human capital. Human capital. Whereas when you look at us here in a country like Nigeria, what we are measuring as our largest resource is our natural resource, which has not been developed. You'll find that, you see, if you look at some of the things I mentioned, so you could have Nigeria now, they say we're the second largest gross domestic product after South Africa. But then, at the same time, we have very poor indices. You have over 70% of people living in poverty. We have the largest number of out-of-school children, the largest number of child brides, the largest, even street children. We have very high poverty rates. Many of our children are, even the schools, children are emerging from school uneducated. The public schools are in shambles. The investments that we need to create an environment to stimulate the brains of children is lacking. And so these aspects are what are really the nation's wealth, because it is the workforce that is going to produce. If you give people tasks and they cannot produce, up to now, I really don't know what we do. We make cars? Maybe you could tell me. I know we assemble cars. Do we make bicycles? I know we may assemble, but can we actually make the little screws and the bolts and the steel and the wheels and all? Most of those things are manufactured. And I also mentioned that I brought into light what we call Abraham Maslow's hierarchy of needs, whereby you start at the base. The base of that hierarchy are the basic needs of life. What? Food, safety, shelter. It's only after those are fulfilled then you can move to the other next level, talk about intimacy, friendship. And then at the top, you have self-actualization, where people can create, where people can innovate. If people don't have basic needs, if the environment has not stimulated them, then there's no way they're going to be able to actualize and create and innovate. I also mentioned issues about assets, things that help a child to do well. I mentioned assets, individual assets, where the child has a positive outlook. But I also mentioned family assets, when the family is stable. The community assets, having good role models. School assets, where the schools stimulate the children. You go to a school, you are happy to be in the school, free of fear. You have your books, you have your toys, you have a big green playground, and things that make you feel good in yourself. Many of those things are lacking in our environment. And that's why I said there needs to be a reorientation in the national agenda, focusing on developing our mental health that would feed into our mental wealth and our nation's wealth. Because the people are what will determine the quality of people. The Human Development Index, is what will determine the wealth of the nation. If all of us, even those who are sweeping the streets, those who are teaching in schools, have a positive, their mental health is enhanced, they have optimal psychological functioning, then the nation is going to rise. If people can go to the office like lecturers, you went through the University of Ibadan. If we have light and water, and then a conducive environment, money to buy equipment, things to do research, and we have peace of mind, then we can sit down in our offices, our laboratories, and develop things and create things. But when you don't even have light, You don't even have paper to work with. And of course, your salary cannot even meet your basic
Afford.
needs. How on earth do you go and creation,
Right. So it is
Yes.
true when they
So there,
say we shouldn't only focus on the quantity, but also the quality of the human capital that we have.
oh
And
yes, we have many people. We are the largest nation in terms of population
Yeah.
in Africa.
Yeah.
And most of them are youth. About 60% of Nigeria's population are below the age of 24. Where we have so we have a lot of potential. But if somebody has been living off the street from when they were young, they have not accessed school, or they've accessed very poor quality school, if they have been abused, physical abuse, psychological and sexual abuse, if they've been neglected, maybe when they were growing up, they didn't even live with their mother, they were torn apart, so they have broken attachments.
Yeah.
How are they going to function when they grow old, when they are adults? And I also mentioned the issue of the fact that studies have shown that children who are abused, who are maltreated, are more likely to develop what we call antisocial personality disorder.
Yeah.
These are people who steal, tell lies, they're corrupt, they don't have a conscience. So there are many, many things that we need to put in place.
Yeah, right. One other thing, let's take this as the last note. You had mentioned that certain risk factors affect or play like a critical role in what we see when people say they have like mental health or mental disorder. You had mentioned school, you mentioned family first, mentioned school, mentioned community. How about work environments, the workforce, where people work? And now you see quite a number of people, especially in the private sector, complain about how they are being maltreated and then they cannot optimally produce or optimally be productive in their space. You come in, sometimes you see people when they come into the office space, they are energized, they are gingered to work, putting all the work and all of those things. But there's always something that dampens the spirit, and then gradually you see them slowing into or moving into depression. I mean, what do you make of that work environment, especially, what do you make of work environment? And what do you make of employers as well contributing to a great mental health or mental well-being of a workforce?
Okay, I think first of all, mental health is everybody's business, and every employer and employee should understand what mental health is all about. If you are a CEO, chief executive officer, or head of an institution, mental health should be your number one emphasis and priority, particularly if you want to make profits. Because if people come to work and they are not happy, they don't have optimal psychological functioning, they are depressed or anxious, and then they're going to make errors. Let's take somebody with depression. What are the main symptoms of depression? And depression actually occurs in about, sometimes studies show, between 20 to 30%. It's commoner in women. Women are 3 times more likely to have depression than men. That's one of the areas. But let's say the symptoms. First of all, low mood. They feel down in the dumps. And they can't help it. It's not something there. If one has a sad event, you may be down for a few hours, but you can still lift. But somebody who is depressed will tell you for like 2 weeks, they just feel down. They're low mood. Then the other major symptoms are loss of interest. So somebody who was previously interested in cooking or reading or typing the computer, doing that, they just find that they don't feel like doing lost interest. Then the third core symptom is loss of energy. So they are just tired. To get up from here to there, they're tired. And then you find other aspects. They have poor appetite. They may have poor concentration. They will tell you, I'm losing my concentration. I cannot focus on this task. They have problems. They feel hopeless, helpless. And then for poor sleep, I mentioned poor appetite already. And then they may have aches and pains. They may tell you, my body is aching. And, sometimes they even have thoughts of ending it all, suicide. Particularly if they feel hopeless.
Yeah.
And then if that kind of person is coming to work, and depression does not show on your face. The person is down, depressed, loss of interest. They're not going to be productive. And there are thousands of people going to work like that. That is why it is important that both employers and employees know so that they can put things in place. First of all, the environment must be mentally promoting. And what I mean is by that is people should be able to go to work without fear. Then, of course, there are other things that will help to promote good remuneration, having security in terms of knowing that your pension, knowing that you have health insurance, if anything happens, knowing, and then decent work hours. I mean, I must say, I'm guilty of that. Many times I work late and I keep some of my staff late. But decent work hours. And then for those who have children, maybe you can introduce things like, for particularly babies, a room within your corporation where a nursing mother can go and breastfeed. So she has freak breaks, even if she returns to work after maybe 6 months, she can go breastfeed her baby. The baby is enjoying good, because breastfeeding is a good mental health promoting activity. It's absolutely essential. And then she comes, she feels fulfilled. And then she can maybe close a bit early. So things that will, and then things to work with. Appropriate breaks. And then another thing that is very helpful is, like somebody mentioned, is having an opportunity to exercise. Exercise has been shown, some studies have shown that with exercise alone, consistent exercise can treat a mild depression. So you can make the environment promoting, mentally promoting, to enhance productivity. And then you go on to prevent. Prevention, there are things you can do so that you make sure they don't have too much stress. If they're feeling a bit down, they can take a break. They have the leave as and when due, and their leave is meaningful. Those are things that you can put in place in the workplace these are universal interventions. And then you also have, for those who have a risk, like if a woman is having problems of domestic violence, there must be a place, maybe a counseling service within the workplace where she can go and say, look, I'm having problems, and then they can get wise counsel. Or if a woman has been depressed before, in a pregnancy, or she had a baby and there's another one. So prevention, having people with higher risks, somebody who has been bereaved needs a lot more support, single mothers, and so on. And then for those who have had a mental illness, because like I said, 1 in 8 people will have a mental illness. Whatever it is, there must be a way in which the work should recognize that this person needs to work, because work in itself promotes mental health. I'm currently I have a project in the university. It's a partnership project between Ibadan, Malawi, Sierra Leone, Zimbabwe, and London School of Tropical Medicine and Hygiene and Tropical Medicine. And it's basically about people with psychosis. It's called Succeed, supporting people with psychosis to be integrated. And we are working back into society. We're working with people who have psychosis. They're actually part of the grant, and they are working as full-time staff on the project. And I've noticed the grant has been on for 3 years now. On our grants in Ibadan, we have 2 ladies. Since they came on the grant and they've been having a regular salary, they've been coming to work regularly, they're having ways to express themselves, they're accepted, and they've had psychosis, that is hearing voices, disorganized behavior, Since then, they've been able to stabilize, they've been able to get married. 2 of them have babies. Oh yes, I have watched as truly their lives have been transformed just by having a good job, well-paid job on a grant, and a job where they feel full acceptance, and they are working with us. We call them experts by experience, where we are experts by training and research, but we are working together as partners. So work does a lot. It builds self-esteem, it enhances quality of life, it promotes mental health.
Yeah, right. It was such an interesting one having this conversation with you. One last one in 30 seconds, please. Very, very short. I mean, you had mentioned that, according to how you said it, that immigrants have a higher risk of mental disorder, especially when what do you make of such instance in a situation where you understand that the major reason why they are leaving the country is basically for greener pastures, and then they get into that place, and then it's all it's an entire ball game. What do you make of such people that have to leave their comfort zone and end up in a space where they now get depressed?
Well, let me just say that over the years, studies have always shown that immigrants, like in the past, when people used to travel to the UK, even Africans and people from the West Indies, they actually have higher rates of mental disorders. Anything that brings change is like I would say, like a stimulus, is a stressor. Once you have a change, and then the second thing is culture. You're living in Africa. In Africa, where like we talk. If I start moving like this, people will greet me. When you're in a culture where you walk on the streets, your neighbors you don't know, you wake up in the morning, nobody knows you. No. And then so issues of stigma, and then also issues of discrimination. And even many times when they try and access the system, there's discrimination at work, discrimination in healthcare. It's all those things are stressors. And then who do you talk to? You're on your own. You have problems. Where do you go? So those studies have shown that immigrants have higher rates of mental health problems. Particularly, there's a study that showed that it was particularly high among blacks. And I think when they compared them to Indians, those who go to India this is a study in the UK. And what they discovered was that those from India they live together in communities. They all live together, and then they live together in generations. So you could have children, parents, their grandparents, all live, uncles and aunties living together, maybe next door, even in the same house. So there was a lot of family cohesion, as opposed to the Africans who will scatter off and diffuse. So those are some of the things that enhance mental health when you have social support. Social support is very, very important. And many people are not planning before they go. They just are following the bandwagon. They just want to leave. They have not planned. They don't realize that the environment, there is a totally, yes, that nobody's going to help you. You're going to be on your own. If you have a child, nowhere, and childcare is very, very expensive. Nowhere to keep your child, and if you don't have it, and people are cold and totally different from us. And then the culture shock of meeting a different culture. You greet people on the street, they'll be wondering, why you greet, why are you saying no? Nobody greets. So, and then you've left your safe haven and you have moved, and then you find that it's a totally different ball. And then, of course, winter can be very depressing. By 3 to 4 p.m. is dark. So maybe you're working in an office as a cleaner or something, or whatever you're doing. You're leaving for work at 7 a.m. during the winter months, it's dark. By the time you're coming back in the evening, it's dark. So you don't see all those things can, studies show that in the winter months, there's higher rates of depression. Then not only that it's cold, and then maybe you don't have enough money for heat and so many things. So, and then even when you go to the hospital, the doctors may not even fully understand your needs. The system doesn't understand your culture and your needs. And so there are higher rates of mental disorders among immigrants.
Thank you. Thank you so much for highlighting this,
Okay.
and most importantly for highlighting the importance of mental wealth and mental health in the nation, and how critical it is to playing to the nation's prosperity, basically. Thank you so much. It was such
welcome.
a great
Thank you.
And that will be all on today's episode of the Women Series. I hope you've picked out one thing or two, and how important it is for us to take care of our mental health as much as we take care of our physical health. To learn more about your personal finance, please follow us on our social media platforms showing on the screen, and you can also check our website at www.proshare.co. Until next time, I am Olayinka Omigbodu. Thank you for watching.